Hi, this is Dr. J. Today, Dr. Jenkins. Today's video is going to be about the heart structures. We'll be talking about the models, the plastic models, as well as the pig hearts, okay? Everything we go over in these lab videos is going to come right from your lab objective sheet, okay? So today I'm going to be covering these things because that's what you need to know. As I'm talking, sometimes I may go out of view just so you can see the models, but you probably don't mind seeing less of me. Haha. When you're looking at the models, make sure you're looking at all of them, because in the lab, some of them are smaller, some of them are bigger, some are in between. Even though they have the same structures, they look a little bit different sometimes, so make sure you familiarize yourself with all of them. They will all be on your practical. Okay, let me first talk about, I'm going to use the big heart. Let me first talk about the basic structures. The apex is this bottom point, and then the base is this upper region close to where the blood vessels are. Apex and base. Sometimes it's confusing because base you think bottom, but in this case the apex is the bottom point and the base is this upper region right below the vessels. Okay? Let's talk about the blood vessels outside of the heart. We have the pulmonary trunk. This is an artery. The pulmonary trunk branches off into a left pulmonary artery and a right pulmonary artery. This is the only place in the body where an artery is blue. In this case, that means that it carries blood that is deoxygenated. We'll talk about why in lecture, all right? But pulmonary trunk splits off into a left pulmonary artery, and it goes underneath here to the right pulmonary artery. Remember, it's left and right as it would be on that person. So if this were my heart, this is the right side, this is the left side. Pulmonary trunk. Just like we have pulmonary arteries, we have pulmonary veins. These are the only veins in the body where they're red, where they're carrying blood that is oxygenated. We'll talk about why in lecture. Right pulmonary veins and left pulmonary veins. The other external structures, we can see the superior vena cava, which is the big vein coming into the right atrium that drains blood back into the heart from the head and upper body, superior vena cava. The inferior vena cava on these models is just this bottom one, but again going into the right atrium, drains blood from the lower body and the thorax. We can see the, let me switch for a moment. I think I said aorta. How could I forget aorta? This is the aorta. It's red because it's big artery. This is the big artery that carries blood that is freshly oxygenated out to the whole body. Good. I'm going to look at the smaller model to show you some of the coronary vessels. The coronary vessels are the blood vessels that supply and drain from the myocardium. This is very important because it's bringing oxygen and nutrients to the myocardium, which allows the heart to actually contract. So on the outside of the heart, we can see the right coronary artery on the right side and the left coronary artery on the left side. Running down the middle here are some other coronary vessels. These vessels sit in a sulcus, or a little depression, and that depression is called the coronary sinus. I'm sorry. You can tell it's been a long day for me. Interventricular sinus, my bad. So this is the interventricular sinus. It's a little depression where these coronary vessels sit in. Okay, let's get back to the heart. So if we take off some of the heart, we're able to see the chambers. All right, this is a front view of the heart, anterior view. So this is the right side as it would be on me, and this is the left side. That makes this the right atrium, this the right ventricle, this the left atrium, and this the left ventricle. I'm just going to check to see it's still recording. Hold that thought. Oh yeah, we're rocking and rolling. The upper chambers are the atria, right atrium, left atrium. The lower chambers are the ventricles, right ventricle, left ventricle. Then we have some valves. The AV valves go between the atria and the ventricles. They're called the atrioventricular valves. The right AV valve is called the tricuspid valve. The left AV valve is called the bicuspid or mitral valve. These valves are held into place with cords of tendon called chordae tendineae. The chordae tendineae, this one's a little bit broken, but you can get the idea. The chordae tendineae anchor themselves to these bulges of muscle called papillary muscle. So in the ventricles, these bigger cylindrical bulges of muscle where the chordae tendineae attach to are called papillary muscle. There's deeper muscle behind it called the trabeculae carnae. Don't confuse the two. Deeper muscles, trabeculae carnae, bigger bulge of muscle where the chordae tendineae attach to is the papillary muscle. Running between the two is the interventricular septum. So this piece of myocardium that sits between the ventricles, interventricular septum. In addition to the AV valves, we also have semilunar valves. This is the pulmonary semilunar valve, a little bit different in shape, and it goes between the right ventricle and the pulmonary trunk, pulmonary semilunar valve. On this model, the aortic semilunar valve is a little bit harder to see, but if you can look inside there, what I'm pointing to is the aortic semilunar valve. It's white. This is the valve that goes between the left ventricle and the aorta. All right, what else to talk about? In the right atrium, even though it doesn't show it that well here, there are smaller ridges of muscle in the right atrial wall called pectinate muscle. Okay, don't confuse these. The small ridges of muscle in the right atrium are the pectinate muscle, whereas the deeper ridges of muscle in the ventricles are trabeculae carnae. In the right atrium, we also have number 36 here on this model. It's a circle. What they're trying to show you here is a depression. So somewhere in this area of the right atrium, there's a little depression, and that depression is called the fossa ovalis. This is where the hole between the right and left atria used to be in the fetal heart, but after birth that hole closes, and what remains is a little depression of where it used to be. So a little depression right here, fossa ovalis. In a fetal heart, when that's open, foramen means hole. This is called the foramen ovale or foramen ovalis, ovale, however you want to say it. Foramen ovale was the hole in the fetal heart. After birth, it closes, and all that's left is a little depression called the fossa ovalis. A couple other things to point out. If we look at the outside of the heart again, we have these little flaps that cover the atria. Those flaps are called auricles. This is the right auricle, a little flap that covers the right atrium, and this is the left auricle, a flap that covers the left atrium. Other thing I just forgot to mention, I did talk about the great cardiac vein. So we talked about the right coronary artery, the left coronary artery. On the back was the great cardiac vein. Right about where this number 6 is, there's an opening underneath the great cardiac vein. And that opening is called the coronary sinus. So if I ask you, what is an opening underneath this vessel? Coronary sinus. It's where all the venous blood from the coronary vessels, all that venous blood drains into the great cardiac vein, and then there's an opening underneath this that dumps back into the right atrium. All right, I'm going to be switching over to the pig hearts, but before I do that, let's talk about some of the keys to identifying the anterior part of the heart to the posterior part of the heart. Again, let me make sure that's still recording. Oh yeah, we're good. Make sure I have it low enough for you. So the key with the pig heart is knowing which side is anterior, which side is posterior. If you get that wrong, then you're going to have the size of the heart incorrect, and you're going to mislabel the chambers and the valves. All right? The top two here are what I would rely on most. Okay? When you're looking at a real heart, the aorta and pulmonary trunk are more visible from the anterior side. The posterior side, you can't see them as well. The second one might be your best bet. The myocardium comes up much higher on the anterior side, whereas on the posterior side, the myocardium is much lower. The last one here is harder to see in practice. The apex of the heart does slightly point to the right on a person, which means if you're looking at a heart in your hands, it points a little bit to the left, but it's kind of hard to see, so I would focus more on the top two. The pig hearts are already going to come to us cut, and they're going to be cut in different ways, so make sure you're looking at a bunch of pig hearts, okay? You're also going to see some pig hearts that are cut this way. Look at as many as you can. These are going to be on the practical. Most people miss questions on these. Just got to spend time with it. So let's talk about those keys. How do I know the front from the back? Well, this is the anterior part of the heart. How do I know? Well, I can see the pulmonary trunk. The pulmonary trunk is right here. The aorta is here. It's just kind of harder to see because it's been cut off. But I can definitely see the pulmonary trunk. That's more anterior, front. Pulmonary trunk and aorta more visible, whereas if I flip it around, I can't see those vessels as well. The other key that I said was that the myocardium is much higher on the anterior side. So anterior side, look at how high the myocardium comes up before it splits off into the vessels. On the posterior side, the myocardium is much lower before we get to the vessels and the auricles. So if this is the anterior side of the heart, it makes this the right and this the left. So if this is the right side, I know that this upper chamber has to be the right atrium. This heart happens to be cut over here. So again, this is the anterior side of the heart, which makes this the right side, left side. If this is the left side, what's this upper chamber going to be? Left atrium. What's the lower chamber going to be? Left ventricle. What valve separates the two? Bicuspid or mitral. Chordae tendineae hold the valves into place. And what's the bulging muscle that the chordae tendineae attach to? Papillary muscle. The trabeculae carnae are the deeper muscle. I can see the pulmonary trunk, as I said. The aorta is kind of hard to see here. With the outer vessels, let me find one. Where did it go? Right here. With the vessels, the arteries are much thicker. So you can look at the thickness of the vessel wall. If it has a thick wall like this, it's an artery. Let me compare that. What my finger is through is the superior vena cava. Look at how thin that wall is. Thin wall's a vein, thick wall's an artery. Something else you're going to be able to do is stick your finger in it. Or you could use one of these sticks to point it through. If you know the blood flow through the heart, you can also figure it out. This is thin walled, has to be a vein. If I put my finger in it, again, this is the front, it's going to come out the right atrium because the superior vena cava drains into the right atrium. The pulmonary artery and vein are hard to see on the pig heart, and usually the inferior vena cava has been cut off. Let's talk about some of the semilunar valves. I talked about an example of the AV valves. This is the left side, bicuspid or mitral. The semilunar valve, a little bit harder to see. If I open up the pulmonary trunk, I get a look at the pulmonary semilunar valve. It's much thinner. Basically two little flaps, pulmonary semilunar valve. I know this is the pulmonary semilunar valve because it's going between the pulmonary trunk and then the right ventricle, okay? Other things to see, let's say that you had a heart like this on your exam. Even without the benefit of having the whole heart, you can still tell which side is which. And how you can do that is looking at the thickness of the ventricular walls. Which ventricular wall is thicker? The left ventricle. So this is much thicker than this, so I know this is the left side. The left ventricle has to pump blood out to the entire body, whereas the right ventricle only has to pump it to the lungs. Not as far, doesn't need as much muscle. So if this is the left side, this is the left atrium, and what we can see of the left ventricle. Right atrium, right ventricle. This is also a great view of the interventricular septum. All right, study hard. Good luck, everyone.